topic here is the establishment of health and demographic surveillance system, HDSS, in Bauchi State, Northeast Nigeria. Baseline findings, challenges, and lessons learned. So the global burden of disease and premature mortality remains a significant challenge for public health, particularly in low and middle income countries. And to comprehend the determinants influencing the population health outcomes and their temporal variations, of course, a reliable and continuous data on fertility, morbidity, mortality, and migration is required. So the absence of functional and comprehensive vital registration system in majority of the middle and low income countries, specifically the sub-Saharan countries, including Nigeria, has severely hindered the collecting of essential data. And Nigeria has a weak civic and vital registration system because over 70% of the 5 million annual births are unregistered, and there is no reliable national record for death and marriage registration. So this gap has surely facilitated the establishment of demographic surveillance system across some part of the country that continuously monitor significant events and provide precise estimate of population changes in resource-limited areas. So what is DSS and HDSS? DSS are referred to demographic surveillance system. They are enduring population-centric frameworks that collect, refresh, and evaluate data regarding birth, death, migration, and socio-economic characteristics within a geographically delineated demographic surveillance area. While the health and demographic surveillance system is a platform that is designed to monitor the illness, birth, death, and other vital events, either through hospital-based surveillance or through community surveillance in a given population. So this is an explanation of HDSS in infographic. Majority HDSS starts from baseline census where a particular geographic area is identified and the entire area is enrolled for the baseline census. And what normally measure is the measure of characteristics of the environment, the household health, and population demographics. Then in subsequent round and follow-up, the HDSS dynamic population is updated in regular visit cycles depending on the planning. Some do it in quarterly basis, some in 6 months, some yearly basis. So, and what is being updated in the HDSS is the number of people that have migrated in within that population after the baseline, that is during the follow-up, and the number of birth, as well as the number of death and the out-migration. So in Bauchi HDSS area, because the HDSS was established under the Child Health and Mortality Prevention Surveillance, which is a global surveillance network operating in 9 countries in sub-Saharan Africa and Southeast Asia, normally conduct what we call minimally invasive tissue sampling procedure, where a sample of tissue will be taken from the dead body of under 5 children to test the actual cause of death, and verbal and social autopsy are conducted to determine the cause of death. So the objectives of this study, that is the establishment of HDSS in Bauchi, is to establish a baseline demographic and health profile of the target communities in Bauchi State, Northeast Nigeria, and also to illustrate the feasibility and challenges of developing a high-quality HDSS in resource-limited setting in Nigeria characterized by high mortality rates. And the significance of the study is the findings of the study provide locally generated evidence from to inform maternal and child health policies and to support the use of surveillance system for data-driven public health intervention in similar settings. The study also provides a platform for pregnancy surveillance, mortality surveillance, and verbal and social autopsy, including a platform for other future nested studies. So the methodology, this is the study area. This is a map of our catchment area population. Bauchi State is located in northeast Nigeria. It lies between latitude 9 degrees, 12 degrees 3 to the north, and longitude 8 degrees 50 and 11 degrees to the east. The state has a total population of 8,308 people, 800,000 based on the National Population Commission projection of the 2022. And the state has two main vegetation zones, the Sudan and the Sahel Savannah. The state has a total number of 20 local government areas administratively, and these local governments are culturally diverse, hosting about 55 ethnic groups. And the HDSS site is located in Bauchi and Ganjo local government area. That is 2 out of the local governments. So from the right-hand side, a map of Nigeria locating Bauchi State, down Bauchi State, a map showing the 20 local government and the 2 local government where our HDSS area is located. And these are the administrative wards. We have 8 administrative wards where the HDSS area is located. And within these wards, we have over 60 communities ranging from 40 villages in the rural catchment area and about 20 urban and semi-urban settlements in the urban catchment area. So part of the methods of the data collection for the HDSS, for the baseline census, we have obtained the ethical approval from the State Ministry of Health Research Ethics Committee, and then standardized CHAMS HDSS questionnaire for baseline and follow-up rounds were used using computer-assisted personnel interviewing system. Then a complete enumeration of household in 18 surveillance enumeration clusters were completed, and the workload is 10 households per day per data collector. So part of the method of data analysis we adopted standard demographic formulas to calculate the proportion rates, the household size, and then descriptive statistics, tables, and summary charts were used to present baseline demographic patterns. The population distribution by age and sex was presented in a population pyramid. So these are part of the key demographic findings. As you can see from the left-hand side, we have enrolled a total population of a total household of 23,658. And then total number of households we visited also stands same. Total number of households we interviewed stands at 23,476 with over 151,672 population. So the key indicators down there are proportion of under 5 children to the total population is about 16.5, and then proportion of aged population, that is 65 years and above, stands at 2.4. Sex ratio at birth stands at 100, then dependency ratio at 104. From the right-hand side is the population pyramid. As you can see from the base, we have a higher concentration of younger population, constituting of about 59% from aged 0 to 15 years. So this shows a young population from the population pyramid. Then the level of education from 12 years and above, we have a larger proportion or large percentage with no education. That is 26.22%, then followed by secondary education. So this demonstrates that the DSS area has higher number of out-of-school children and higher level of illiteracy. Then part of the employment status, about 49% of the population are unemployed, that is from aged 17 and above. Then with 41% self-employed, full-time employee stands at 7%. The right-hand side represents the marital status of the population. As you can see, 56% of the population aged 15 years and above are married, with 41% single and other. This is the percentage of water, sanitation, and hygiene indicators. So as you can see, majority of the population use tube well borehole, then followed by dog well, protected well, and unprotected well. So part of the cooking fuel, as you can see, wood, grass, and straw shrubs recorded the highest number of percentage. And this demonstrates that there might probably be high rate of cardiovascular diseases relating to lungs infection and pneumonia for children under 5. Then the cooking location on the right-hand side, 43.77% takes the highest. Majority of the population has separate room for cooking. So part of the toilet facility, majority of the population use pit latrines with slab, 55.10% as represented in the charts. Then the toilet location, majority have their toilet location in own dwelling. So part of the challenges and lessons learned in the establishment of this HDSS is the use of outdated enumeration area data and sampling limitations. The last population census that was conducted in Nigeria was since 2006. 20 years now, and the last enumeration area demarcation was conducted in 2005. So the use of outdated enumeration area map due to the unavailability of the current enumeration area maps has created a lot of gaps due to the fact that a lot of communities has fully developed into multiple clusters. So we find it very difficult to enroll all the communities at the initial stage. Then delays in administration and lack of trust in community, which was later addressed by empowering people from the community to conduct the exercise. Then seasonal temporary migration in some communities has hindered the process of the enrollment of household in those communities after line listing and community mapping. So technical problems with data device captures, of course, we have faced a lot of problem due to the fact that we have adopted the software application from the HDSS Terms Leadership Center. But a capacity building training was conducted to the ICT team where we have the access of maintaining the application. So the Bauchi HDSS successfully established a surveillance framework which identified a young population with significant public health concerns, and it shows that it is possible to establish demographic surveillance system in a place with high mortality by using target strategies like getting the community involved, hiring local staff, demarcating the fields, and building technical capacity. So these are some of the references we use in the paper. Thank you.